Hello and welcome to this new quick demo of Business Analyst for the health industry. Business Analyst is one of the most powerful tools we have for supporting hospitals and health-related organizations. Basically, Business Analyst is the combination of a huge amount of socioeconomic and behavioral variables with the analytical power of ArcGIS. Let me show you today some of the great capabilities you will have access using VA. In this scenario, the hospital has noticed an increase in the demand for geriatric services. Based on this observation, they would like to examine whether it would be strategic to extend their network with a new clinic focused on the needs of older adults. At the same time, they want to ensure that they are serving a real unmet need and not simply adding to the competitive landscape. So let's use some of these powerful capabilities. So let's start mapping information of the distribution of older adults that are under Medicare in this community. It is really easy to map relevant information in Business Analyst. I just need to go ahead to create maps, select color code maps, and then, as you can see, we can access to different databases, information related to population, income, age, health-related information, and even consumer spending and behavioral data. Let's start with age. Here, I can create my own variable, and I can specify what dataset I want to use. I can use the 2010 census information, or I can use the 2019 or 2024 projections made by Esri. Let's go ahead and select 2019. Then I can specify the age range. For this scenario, let's go ahead and select all the people over 65 years. Then I will select both genders, save, and in less than 1 minute, I will have all that information mapped. What you're seeing here is a map that is showing you all the census tracts in this community. The reddish the census tract, the higher the number of people over 65 years per census tract. Moreover, what I can do is go ahead here and select a new variable. And in this case, let's go ahead and look for Medicare. We have here the variable. And now what you are about to see is a combination of these two variables. Here we have a different kind of symbology, and we are using the raw number for each of these variables. I can change this specific data, people over 65 years, and not only see the raw number, but I can see the percentage of these people in comparison to the whole population per census tract. Now, it is easy for me to understand this information. The bigger the circle, the higher the number of people that are under Medicare. The darker the circle, the higher the number of people over 65 years old in that specific census tract. So you can see the pockets of my specific target in different areas in the community. There are pockets around my current offices in the Fort Worth area, as well as in Richardson. But also there are pockets in Colleyville, Arlington, and Duncanville that could be potential places to open a new office. So the question would be, where we should open this new clinic. Here's where the power of Business Analyst comes alive. First, I'll create a map that simply highlights these potential areas. But also, I want to add another variable to evaluate where I already have some market penetration. So to do that, I will use a new functionality called Smart Search. So let's go ahead to create maps, select Smart Map Search, And again, I will select my variables. But the good news is that those variables are now saved as favorites. So I can go ahead here and select those. The difference now is that I can access now to my internal database. Because in Business Analyst, you can connect your own internal database and access to information, for example, as the number of patients that you could have per each census tract. Here, for example, we are taking that information, these three variables, and now, in less than a minute, we will have our smart search environment. Here what I can do is to filter my information. For example, I want to see only those census tracts that have more than 20% of people over 65 years. The same with the Medicare population, more than 20% of people under Medicare. And I want to see only those census tracts that have less than 20 patients. You are seeing only those census tracts where I am fulfilling those requirements. So now I can handle off these potential locations to my market development team or real estate team so they can start looking for available spaces to lease or purchase to extend our network. So now, after they finished that research, they came back to me with 3 potential sites for our clinic. And now, I can continue my geospatial work by evaluating which one of those will be the most suitable for our purposes. For that, I will use the suitability analysis workflow. Let me start showing you these 3 potential sites here in red in the map. I am going to compare the potential of each of these 3 locations by first creating a service area polygon for each one. You will see how easy it is to set up this layer. So let me go ahead here, set up layer, and then specify that I want to create these 15 minutes driving time polygons. There we go. Behind the scenes, BA takes advantage of the street network data of ArcGIS to create these polygons based in this 15 minutes dry time. In other words, any patient within this service area is located within 15 minutes or less from these potential offices. I can use this layer to start with my suitability analysis workflow. As you can imagine, investing in a new clinic is an expensive proposition, and I want to make sure I have the best chance for success and minimize the financial risk. So what I will do is add my variables that, as you know, now are part of my favorite variables. People over 65 years that have Medicare, the number of patients that are coming from my internal database. But now I will use another variable, which is the distance of these potential locations to my competitors. This variable was generated using one of the amazing capabilities in BA. Let me show you that capability. If you go to Create Maps and select Business and Facility Search, you will see that you can do a NAICS code directory search. For those of you that are not familiar with NAICS, NAICS stands for the North American Industry Classification System. As you can see, the code number 62 is reserved for health. Now let's go ahead and let's find the code for HMO services. Once I find the code, I just need to copy this number and then look for all the businesses that are under this specific code. I can now take this layer and use the information as one of my decision-making criteria after I perform a process to calculate the distance to our competitors as a variable. So let's do it. Let's go to Run Analysis, Suitability Analysis, and now as you can see, I have the distance to competitors as one criteria. You can see how the software has merged all these variables in order to create an index. I can change the weighting of any of these variables. For example, older adults is really important for my analysis. So let's assign it 35% of weighting. Also, the variable Medicare, it's important, so let's assign it 20% and lock it. But also, we think that a more suitable site would be one that is farther from our competitors. So we will make this relationship in distance to competitors an inverse relationship. And we will assign this 35%. You can see how the index change according to the modifications in the weighting. And finally, I can see that Duncanville is the most suitable area to open a new clinic. Finally, once we have a result like this one, we are ready to act. Not only we can decide what is the best place to open our new clinic, but also I can go further and I can develop a deeper understanding of what kind of population I am tackling in this area. This information is easy to access using something that we call infographics. Here, for example, what you're seeing is a key facts infographic that shows information related to education, employment, the number of businesses, and even income. But let me show you something really cool. We have something called tapestry segmentation. Basically, this is a system that identifies 68 distinctive market segmentations in the US based on socioeconomic and demographic characteristics. If I go ahead here, you will see that more than 13% of the population here are classified under American Dreamers. If I open the report, you will have access to really strategic information. For example, you will see what are the favorite TV programs that they are seeing. You will see that these specific residents listen to urban and Hispanic radio. And even you can have a taste of what are the kind of activities that they used to do. This information is critical because it allows you to understand what could be the best way to reach out to these people. And this is part of Business Analyst. So this was a tour across some of the functionalities of Business Analyst. We in the Health and Human Services team are ready to answer any of your questions. Thank you.